Welcome back, everyone. I hope you had a refreshing lunch break. My name is Shilpa Raju, and I will be co-moderating this session with Chantal Bemure. I'm a double lung transplant recipient of 12 years and a kidney of almost 1 year. I have the privilege of being a patient partner co-lead with the CDTRP for many years now. And for this next block, it's entitled Methods to Capture the Patient's Voice and Optimize Patient-Centered Care as part of Hybrid Block 4, Restore Long-Term Health, Theme 5. So I'd like to start by inviting Nolan Marblestone for his presentation entitled Association Between Social Participation and Anxiety Among Kidney Transplant Recipients Using PROMIS. Nolan Marblestone is an undergraduate student at the University of Toronto, majoring in global health and medical anthropology. His current research centers on improving the quality of life for patients with chronic conditions through patient-reported outcome measures. Nolan aspires to further his education in public health and public policy to address systemic health issues, particularly for marginalized communities.
Is this a loud enough volume? Good. Hi, everyone. My name is Nolan, and this is Association Between Anxiety and Social Participation Among Kidney Transplant Recipients using the Patient-Reported Outcomes Measurement Information System. So I have no disclosures. Kidney transplant recipients report better quality of life than patients on dialysis, though as we know, this is still a chronic condition, and so many life domains can impair quality of life. So anxiety and low social participation are two of these that we know patients report as being highly frequent and also highly detrimental to quality of life. So we know that components of social participation, which includes paid work, volunteer, school, your social life, so it's really encompassing of a lot of things, as well as anxiety, are associated in the general population, and that this relationship is bidirectional. So they're both influencing each other. But this relationship has not been explored among kidney transplant recipients. So we wanted to use the patient-reported outcomes measurement information system, which is an electronic patient-reported outcome measures tool that helps to quantify patients' illness narratives in an effort to increase patient-centered care. So we wanted to use this to explore the association between these two life domains while adjusting for clinical, demographic, and other life domains as covariables. So this is from the same study that Jad talked about this morning, so it should sound a little familiar. But we recruited a convenient sample of adult kidney transplant recipients. They were either recruited immediately after their transplant while they were staying in Toronto General Hospital, or after discharge in a post-transplant clinic. But for patients that were recruited right after their transplant, we waited until 12 weeks after recruitment to collect cross-sectional data for this analysis, just because social participation can be a bit funky when staying in a hospital, or at enrollment for patients recruited in a post-transplant clinic. So patients completed, or participants completed PROMIS item banks as either a short form, so that's a fixed length questionnaire, or using computer adaptive testing in which questions are delivered based on responses to previous answers. Moderate to severe anxiety was defined as a PROMIS anxiety T-score greater than or equal to 60, and low social participation was a score less than 45 on that domain. We use these based on distribution-based cutoffs for the general population, and then we also included fatigue and physical function domains as covariables. Here's a quick flow chart of our study process. So we had a total cohort of 372 kidney transplant recipients. All 372 completed anxiety and social participation questionnaires. We also collected a demographics questionnaire and extracted clinical data from electronic medical records. A quick rundown of the stats we used. Pearson's correlation to measure the association between social participation and anxiety. Linear regression to explore the relationship between social participation and anxiety on a continuous scale while adjusting for all the covariables we're about to go through. And then logistic regression to look at the odds of having low social participation given a participant has moderate to severe anxiety. I won't go through all of our covariables, but we kind of grouped them into a demographic category. So that's age, sex, ethnicity, immigrant status, and material deprivation. Some clinical values, and then also fatigue and physical function, like I mentioned. So of our 372 participants, about 1 in 5 had moderate to severe anxiety, and almost 30% had low social participation. And then just graphing them here, we can see there's a moderately strong relationship between anxiety and social participation. So anxiety is on the x-axis here, and a higher score represents more anxiety, so a lower score is healthier. And for social participation, it's the opposite. So that's the y-axis, and higher scores mean more social participation. That would be considered healthier. So this direction is what we would expect. And then I added on here lines showing our cutoffs for moderate to severe symptom burden, like we talked about earlier. So this bottom right quadrant is really who this project is focused on, seeing, okay, if there's enough evidence that anxiety and social participation are associated, would it be worth looking into extra screening for patients that present with one of these symptoms? For linear regression, we can see that in the first univariable model, they start out quite associated with each other. So for a 1-point increase in anxiety, social participation is decreasing for half a point. And then as we slowly add in more and more of our covariables, this decreases, which is expected. But it still remains quite strong in the last model when we have everything together. So for a 1-point increase in anxiety, or 5-point increase in anxiety, we're seeing a 1-point decrease in social participation, even after adjusting for clinical, demographic, and other PROMIS domains as covariables. For logistic regression, I think this is particularly helpful since often patients need to be classified into these categories to see if they need support or not. So this is looking at if a patient is presenting with moderate to severe anxiety, what are the odds that they will then have low social participation? So in a univariable model, this is quite high with an odds ratio of almost 7. So 7 times more likely of having low social participation if you have moderate to severe anxiety. And then again, as expected, this decreases as we add in more and more covariables. Once fatigue and physical function were included together, the p-value is not significant anymore. So it's not necessarily showing a lack of association. We already showed association, but once we kind of classify these groups, we don't have it's harder to show in a logistic regression a significant odds ratio, and it kind of shows that fatigue and physical function are also grouped together, so these life domains are all intertwined. It informs that biopsychosocial understanding of health. So we can conclude that low social participation is associated with anxiety in adult kidney transplant recipients, though fatigue and physical function may contribute to this relationship, as well as other life domains. So this can help inform clinicians and patients of the relevance these life domains hold for each other. And I'd be very curious to see future studies exploring how interventions for either anxiety or social health affect overall quality of life after kidney transplantation. Thank you very much, Dr. Mucci, for all your help this summer. Everybody here at CDTRP, the other authors of this project, and our research group, and all of our participants. Thanks.
Thank you very much, Nolan, for your excellent presentation. So I will now open the floor for a couple of questions, if anyone has questions before we move on to the next presentation.
I just had a question. Did they just complete the PROMIS questionnaire at one time, or did you collect? How many times did they do the questionnaires?
So this was drawn from a longitudinal study,
Okay.
but we took a cross-sectional analysis of that. So we only took for incident patients that were recruited in the hospital right after their transplant. We took the questionnaires at 12 weeks, and that's all we analyzed for this.
Okay.
And at enrollment for patients who had already received a transplant. But there will be more as more patients continue to complete them for a full year, more opportunities to look at how that changes maybe.
Okay, thank you.
Any other questions?
Oh, hi. Great presentation. It's great to see that Dr. Istvan's work is being put into action. I worked with him on the proms, and it's great to see that this is being used. I think having this information before a patient goes in to see their doctor and their team, it's important to know what are the main things that they are dealing with and where they would like to see. And a lot of times, mental health and sleep and pain are not things that are discussed because of the timing. But Chantal and I's approach as co-leads for Theme 5 is how do we get to a point where we're having a holistic point of view when we look at our care. So, you know, a lot of times we go in and it's like your liver numbers are good or your kidney numbers are good, everything's fine. But then we walk out of the office and go, yeah, well, what about this? And because I have the advantages of being 27 years out, I've seen a lot of friends on Facebook that suffer from anxiety and depression, and they didn't want to say anything. So now if we normalize it and say, yeah, these are the things that can happen, and I think we can do that by prompts. And I know that Sick Kids with Samantha is doing it, and I love to see it, you know, rolled out to all of the transplant programs. So good luck. Thank you.
Thank you very much.
I just want to say thank you so much for your presentation. It resonates a lot with me. I post-transplant, I have a daughter, I had a transplant, and I have also a huge social network at the time. But when you come out of transplant, you don't relate as well to everybody else around you, nor do they to you. And so your social network becomes very small. People don't have the bandwidth to, you know, listen and support you. And it is really hard because it's not always easy and happy. It's very hard. And it's a huge transition for everybody. And so I found that I lost a good chunk of that social network. And the people that I relied on became smaller and smaller. And so once I found people within the transplant community who shared similar paths, I felt that I was able to feel like I belonged again, and I was able to share. And the funny thing, as heavy as their stories are, there's always space to hold space for each other because you share a common path that is unique, but at the same time, it allows for you to have that connection. You support emotional, you provide mentorship, education, resources to each other. So it just, I really thank you for bringing this to light because, you know, maybe part of what it is looking at social network a little differently and trying to connect people differently. So thank you.
Yeah, thank you so much.